Hey everybody, Dr. Rocky here. We have our interview with Dr. Cassandra starting any minute, and I hope you guys look forward to learning as much information as you can from her, as I am looking forward to it as well. Hey Dr. Cassandra, I'm glad you joined already. Give me 1 second so I can, oh wait, there it goes.
Hey, how are you?
Hi, I'm good, thank you. How are you?
I am so good. How is Canada treating you?
Good. It's cold, but it's treating me okay.
You know what? I am in Houston, Texas, and it is cold right now.
Really?
It's like 30 something degrees.
Wow. And you
Yeah.
guys don't usually get cold.
No, no.
Oh,
No.
okay.
So
It's feeling a little bit like Canada down there.
yes, and it's supposed to, they said there's like a Arctic storm or Arctic cold front coming through, and it might snow on Monday.
Really?
I'm like, I'm not ready.
Are you guys equipped for snow?
The city, oh heck no.
Yeah, I
City
don't
is
think
not,
so.
no, there are no salt mounds anywhere. There are no trucks going around to sprinkle
Yeah.
salt and sand up. No, not at all.
Okay, good
So,
luck.
right. Okay, but enough about me. So let's just go ahead and get started. Let's tell everybody about yourself.
All right. Okay. So I'm Dr. Cass. Most of my patients call me Dr. Cass. I've been a chiropractor. It'll be 4 years this year. Sorry, 5 years this fall since I've been practicing chiropractic. And I'm in Canada. I'm in Toronto. That's where I've been practicing my whole career. I went to school in Canada as well. So I went to CMCC. So the States has a lot of chiropractic schools. Canada only has two, actually.
Hmm.
So it's can be a little bit harder to get into school here. We have one all French speaking school, so I'm not fluent in French. So unless you are fluent in French, that you can go to a school in Quebec. And then we have CMCC. Canadian Memorial Chiropractic College, which is here in Toronto. So I also applied to the States. I applied to NYCC just because it was a little bit closer. But then when I
Hmm.
got into Canada, I obviously stayed in Canada because those international student fees are something else that I did not want to pay. So I was happy that I also got into Canada, and then I stayed in Canada and I did my schooling here in Canada. And then in terms of my undergrad, I went to a university here in Ontario called York University, and I got my Bachelor of Science there. And now I am here in the city practicing and doing what I love.
That is so awesome. I heard I had a classmate that was from Canada. She didn't end up
Mm.
going back. She fell in love and stayed here in the
Oh,
States.
okay.
She lives in Missouri because I graduated from Logan, so she's in
Okay.
Missouri.
Mm-hmm.
Um, but she was saying that the laws in Canada to become a chiropractor are a lot freer
Mm.
than out here. You guys have a lot more range of depth that you guys can do, which is really cool.
Yeah.
So are you a associate or do you own your own practice?
So I'm an associate, and I work in two clinics, and or I guess I work in one clinic and I work in one inpatient facility. So people are always surprised about where I practice my second clinic. So my first clinic is a regular community-based clinic, multidisciplinary clinic, chiropractors, physios, naturopaths, massage therapists. But the second place that I practice is a mental health and addictions facility.
Oh,
Yeah, so I practice out of there. And it's very different from my community-based clinic. A lot of pain management. And it's an awesome environment to practice in because you really get to see, and not that practicing in my community-based clinic, my patients are very grateful, but you really see how much benefit you're putting into someone's life when they're in a place like that. And sometimes you might not feel that chiropractic can make much changes in that kind of scenario, but I've been at that facility since I graduated, and it's been awesome. So I really like the two different ends of how I'm practicing right now. So I'm an associate at both, and I'm really enjoying it right now.
that is really cool. I want to go. talk just a little bit more about the mental health facility, because you
Yeah.
don't hear a lot about that. I've
Mhm.
actually, I don't think I've ever heard of someone saying that they've worked in a mental health institute, which, I mean, that's not saying much, right? I don't know
Yeah.
everybody. I don't know a lot, but um, how did you even get into working at a mental health facility?
Yeah, so it's awesome. And I'm actually doing a talk later this month with the SAPCA North Western Division.
The
We
one
don't
in
have SAPCA in
Chicago?
Canada, so
Okay.
it's we don't have that which I think is a phenomenal organization. Hopefully, we can get
Hmm.
something like that here going in Canada. But how I got to working at my inpatient mental health addiction facility is when I was in first year chiropractic school. I was just looking for a job, and they had a position as a physical health instructor. So you just go in, do exercise with the clients, and I was just like, okay, perfect. I didn't actually know what the facility was. I was just like, I have a kin background, studied fitness, I can do this. When I got the job interview, that's when I researched what the actual place was, and I didn't even know we had facilities like that in like the greater Toronto area, which also I thought was phenomenal. And then, so I stayed on all throughout chiropractic school. That was my part-time job. When I was getting ready to graduate, I emailed the medical director and I was just like, would you guys ever be interested in offering chiropractic services? They had massage and they had acupuncture. And he was like, yeah, we would be open to it. So when I graduated from that email, we were able to just start chiropractic care in there. And then I've been there ever since.
Oh, wow. That is
Hmm.
so awesome. For those of you guys who are just joining, we're talking with Dr. Cass. She was just talking on working in a mental health facility, which is very interesting. You started from the ground up essentially, so you didn't start as a chiropractor. This is a new position to you, to anybody in that facility,
Absolutely.
what you
Absolutely.
created.
Yeah.
That
And
is really awesome.
it's so at the beginning, I wasn't too sure how it was going to work, how I would get patients and things like that. But it's so phenomenal in terms of a lot of people's reason why they are there and why they are battling the addictions aspect and even the mental health aspect started with some sort of physical pain, right?
Right. Yeah.
Started with some sort of back pain, post-surgical type pain,
Mhm.
and they never had that chance of maybe seeing someone before they were offered a drug like an opioid. And here in Toronto or in Ontario right now, we're having a really, really bad crisis when it comes to opioid overdoses. So that's something that's been happening. I think the last couple of months, the deaths that we've had from overdoses have been like skyrocketing. So when I'm in that facility and I'm able to treat people who it started with back pain, like what do we treat? We treat a lot of back pain. And a lot of cases started with back pain in pregnancy, right? So when they're able to see, okay, there's another alternative of getting relief without having to resort to drugs. Being able to show someone that is phenomenal. Like, it's amazing. So that part I think is one aspect, but the other aspect is when we're treating someone, we are helping with their stress levels. We are helping with their anxiety levels, right? Like if someone
Right.
has tension in their shoulders and you can help them to relieve that tension, that helps them to relieve their stress, right? Especially if stress is what is causing that form of tension, discomfort that they're feeling, dis-ease that they're feeling. So that's another aspect that I find in my practice a lot is sometimes you don't know how much you're helping someone by just making them feel more comfortable.
Yeah, I think that is phenomenal that you work with these patients, because I try to tell patients all the time, they're like, how did I get like this? I didn't do
Mm.
anything to hurt myself. And I'm like, it's not necessarily that you did anything. It's just the
Mm-hmm.
stress on your body over time and
Mm-hmm.
your
Mm-hmm.
daily activities. Maybe at work,
Absolutely.
you're having a busy week and you're just
Mm-hmm.
not used to it. That
Oh
really
yeah.
causes a lot of pain in the body.
Absolutely.
And
Absolutely.
manifest, like mental health and physical health are so intertwined. I feel like you
Yes.
can't have one without the other.
Absolutely. Like if you think we think about stress a lot and we think about the person who's like, oh my God, I'm gonna pull my hair out. But it's like stress is like an upset stomach. Stress is like
Right.
tension in your shoulders. Stress is like I have a headache. Like all of these things, that's how I feel when I get stressed out. Like when I feel
Mm-hmm.
stressed, my body just doesn't feel great. And it's not something that I can pinpoint like I sprained my ankle. It's just my body just does not feel great. Like
Right.
it's such a subjective thing, but that's how stress presents itself, right? Stress is like, I'm extra tired today. I feel extra tight today. I feel so sometimes we think about stress and it's like it manifests physically first.
Yeah.
You'll see those physical symptoms before you see anything, like restless leg syndrome, even old injuries starting to come back. Usually I have patients who come in like you said and they're like, I don't know what I did, this was feeling so great for this period of time, and I'm like, okay, let's go back and see what happened over the last couple of months. And everyone expects there to be like one thing that triggered it, and I'm like, well, you were sleeping less this past month. Well, you weren't drinking enough water this past month. Well, work was super stressful this past month. Well, we're in a pandemic, right? Right? So, and then we go back and we see all of these things and it's like, yeah, it wasn't one specific event. It was life is hard sometimes and it will take a toll on your body. And that's one of the reasons that we do what we do. It's not only for the person who is in quote unquote stereotypical pain, right?
Mm-hmm. Right. That's so awesome. So what can you tell us about like your patient flow? What do you in both facilities? So
Mm-hmm.
talk about what you do with the in the addiction mental health facility, and then also
Mm-hmm.
how you deal with the regular patients and just
Mm-hmm.
the flow of traffic and how you work those patients, so people can kind of pull some ideas from you
Absolutely.
and see
Absolutely.
what they like from how you do yours, and
Mm-hmm.
what they don't like or whatever, and they're like, "Ooh, that's
Mm-hmm.
a good idea," because we can pick and choose from each other and
Absolutely.
learn so much from how we do our practices, because we're all different
Absolutely.
and we all have different things in our minds, and we don't really
Mm-hmm.
realize some of the things
Mm-hmm.
that we're like, oh my God, I never thought about that. I wish I
Yeah.
would have.
Yeah, absolutely. Generally, I feel like my practice style is pretty much the same in both. And I just feel like I tweak things from one clinic to the other. So I practice diversified and I adjust manually. And I also do neurofunctional acupuncture. And I do a lot of soft tissue as well. So let's start with my community-based clinic. I feel like with community-based clinics, those are like your lifelong patients, right? Like those are
Hmm.
patients who, for the most part, you're going to be seeing them pretty regularly and you're part of their wellness, right?
Right.
So when I'm dealing with that, of course, we'll have like specific injuries that we might be dealing with, but also it's more just general upkeep and wellness and making sure that you're just able to live life optimally and your body feels great. The other thing that I really like about my community-based clinic, it's called the Health Institute, is we are very multidisciplinary. So like I said, we have a naturopath, we have a massage therapist, we have physio, we have trainers, and I love that I have other options for my patients to go to, right? Let's
Hmm.
say something, if I want to deal with something nutrition based, of course I've studied nutrition, but am I an expert in nutrition? I wouldn't say that. So I'm going to send you over to my naturopath. If you're telling me, I've been noticing some indigestion that might be messing up with my back pain, I'm going to refer you to my naturopath and we're going to tag team that so that we're dealing with both aspects of that. One of the things that I love to do is, especially with females, especially with older females, is once I start getting them, if they came in for a specific reason, is I love to get them strength training, right?
Yeah.
So exercise will always be part of my treatment plan. Like any patient I see, we're doing some sort of exercise because I just totally believe that the stronger your body is, the better that you're going to be lifelong.
Yeah.
So I
Physically. Uh-huh.
always, after I get them to a certain point, I'm like, okay, you're good. I just want to see you regularly for maintenance. But I would think it would be a great idea for you to start getting stronger with one of my trainers, right? So I really like that clinic because it's just such a multidisciplinary clinic and we're such a family-based clinic that I feel like we work really, really well together.
It sounds like it. I think that
Hmm.
the multidisciplinary is something that we all need to start maybe getting towards,
Yes.
because we all have a place, and we all need each other in some way, shape, or
Yeah.
form.
Yeah.
MDs have gotten it, I think, a little bit. They've gotten it right to where they're like, you have this problem, go ahead and talk to this
Yes.
person.
Yes. Yes.
Um, And I think it would be beneficial for us to get together with all those natural doctors so that we
Absolutely.
can start going back and forth and helping each other. Not
Absolutely.
only helping each other have patients, but also helping our patients get the best care and get the
Yeah,
best treatment that they can by having
absolutely.
all those different disciplines together.
Like, I don't want to be an expert in everything. It's too much to
Right,
remember, right? I want to
right.
be an expert in your musculoskeletal system. But if something comes up where I think someone else might be better for you, I feel like sometimes we're scared of like, oh my God, I might lose a patient. But I don't think it's about losing a patient. I think that builds trust and that builds rapport with your
Yes,
patients where you're able to say, you know what, I'm not an expert in this field, but I want you to go and see my acupuncturist. I want you to go and see my naturopath because they're an expert in that field, right? And that just builds trust with the patient. They're like, oh my gosh, you're not even trying to like fake it till you make it. You actually care about my well-being, that you're sending me off to a specialist. And all of my patients that I've sent either to whatever, may it be massage, may it be naturopath, may it be whatever, I've never lost the patient to another practitioner, right? They always come back and now they're working on one aspect and their treatment is better. So I think
right.
sometimes we get scared of losing patients, but it's not about losing patients. It's about what's the best fit for this patient.
Well, I think when you pass patients on like that,
Hmm.
sometimes maybe that patient just wasn't the fit for you and they did need to go somewhere
Yes,
else. But they
absolutely.
have someone that comes into their life that does need your services. So they're
Hmm.
like, you know what? I know someone. I love this doctor. I trust
Yeah,
this doctor.
yeah,
They told me to go to XYZ because that's what
yes,
I needed to take care of and they
yep,
weren't trying to keep me. So you should go try her because I think she
yes,
really can help you. Like,
absolutely,
so it's like
absolutely,
it builds not only the trust, but it builds more referrals, longevity,
absolutely,
because they're like, well, I know this person's going to give you the best care that you can. And if
exactly,
they can't give it to you, they're going to give it to somebody else that they know will be able to take care of you and that
exactly.
you can trust.
Exactly. And I think that trust is the key word. Is like you just
Hmm.
when someone builds trust with you, like the referrals come in,
Right.
right? So it's building that trust. And like you said, sometimes it's not the right fit. Like I've had conditions where I've been treating, and I'm just like, what's going on here? Like why are we not getting better? Like I'm doing everything, you're doing what I'm asking you to do as a patient, I'm doing what I'm supposed to be doing, and we got to refer you out. Every patient who I've had to refer out in that kind of circumstance has always come back and was like, man, Dr. Cass, thanks. Right? Like we figured it
Hmm.
out. Because all they want to do is be able to figure out whatever the
What's
problem
going
is,
on?
right? And
That's the key.
I may not be the person who is able to figure it out. And
Yeah.
I think that's just patient quality of care. Like if we keep hammering away and we're not getting any results and we're not trying to find a different path, I don't know how much quality of care we're really providing there.
Right. No, that is true. So you said you do things pretty similar in the other clinic. So what do you do different in the other clinic?
Yeah, so I think with the other clinic, the thing that's a little bit different is it's a very direct program that they're in when they're in there, and it's a limited program that they're in as well, right? They're only there for a certain amount of time, so they're there for let's say 6 weeks, 9 weeks, in terms of what they need to accomplish while they're there. So we have sometimes the goal is a little bit different because I may not be their chiropractor forever. I'm going to be their chiropractor while they're there for the
Right.
reason that they're there for, right? So sometimes it's a lot of just managing how the body feels as they're going through this process. It's not an easy process to go through, right? To say, I commend their bravery to say, I'm going to step away from my life for this amount of weeks. I'm going to step away from my children, my loved ones from this time of weeks to come here and get better, right? So it's more me just saying, how can we make you as comfortable as you can be while you're going through this process? A lot of them are getting their body back in this process, right? They haven't been in touch with their bodies in so long. So a lot of them are just getting reacquainted with their bodies. So it's like, how can we make this process as easy for you as possible? And that's more, I just tweak my treatment skills to a little bit more towards what they need during that time that they're staying in the inpatient facility.
Yeah, well, that makes sense. Even though you're only treating them for a short amount of time, I'm sure
Mm-hmm.
you're making a huge impact on their recovery and letting them know that they don't need to have the opioids to treat a disc herniation. They don't
Yeah.
need to have because they have headaches, take a bunch of medication. They can get
Absolutely.
adjustments on a regular basis,
Mm-hmm.
and that really will help to improve
Mm-hmm.
their symptoms
Yep.
so that they can return back to normal,
Yes,
or
absolutely.
with less pain. Like that
Mm-hmm.
that right there is like a huge difference. I had a patient just earlier this week. She brought in she had an X-ray, and the herniation was seen on the X-ray. That's how bad it
Mm-hmm.
was. The
Mm-hmm.
doctor who took the X-ray didn't even tell her what was going on. Just, you have a herniation, and didn't say
Yeah.
anything else to her, and was like,
Yeah.
here, go somewhere else. I
Yeah.
can't handle it. Take it easy.
Yeah.
And I adjusted her, and she was just like, I can stand up.
Yes.
Like, I can do all this stuff that I wasn't able to do. And it's like,
Yeah.
it's okay to get, alternative care for the herniations,
Yes.
or
Mm-hmm.
low back pain, or neck pain, or upper back pain. It's
Mm-hmm.
okay. Just try it out, and
Yep.
you might save yourself surgery and more pain
Yeah.
down the line.
Yeah. I want to touch on two things you said. The first one is that no one explained it to the patient. Something that I see in my clinic. So one question that I always ask my patients, if they come in with imaging, or if they come in with a requisition from a doctor and it's like the diagnosis is written out, I always ask them, did anyone explain this to you?
Right. That's what I have to do too.
Mm-hmm. It's so interesting how many people are not explained, like either their imaging or the diagnosis. They're just saying, okay, yeah, this is what you have. And I always ask them, like, did anyone explain this to you? And then I pull out my images and bring up my spine and all of that kind of stuff. Because if I think if people understand what's going on, it's like the first base of them just feeling better. Like, I've seen it in my clinic where all I've done is explained to someone what is happening, and they already look so much more comfortable. And I just think, like, the unknown is very scary. So especially when it comes to your body. So if you don't know what's going on, then you're in more stress. We know stress increases how you feel pain. We know stress increases pain intensity. So just knowing what is going on is huge. And I wanted to touch on something else, but I forgot, and it'll come back to me.
It's okay. That also made me think about too, is it kind of gives them relief when it's explained.
Yes.
Like, they're like, oh. And then also, some of these conditions, they're told you have this, but they don't really explain what it is. And people, you tell them, I think you probably have a disc herniation, and they're like,
yeah,
oh my God. And it's like, no, it's okay. Yeah. It's common.
Yeah.
Or you tell them, I think your rib might be subluxated. What does that mean? It's like, it's okay. It's a common condition. A lot of people have it all the time.
Yes.
Treat this all the time in the office. Get you some adjustments under your belt, and you'll start to feel a little bit better. We're going to let that dish do its thing and get back into the place that it's supposed to be.
Exactly. And that goes to, like, terminology. I find, like, sometimes, it's the education piece, right? It's like, if we went and took an MRI of half the population, we know so many people would have a disc herniation and not know that they're walking around with a disc herniation, right? So a lot of it, the other one that gets me is arthritis. It's like, it just makes me cringe. It's like, we want to live to be old enough to have arthritis. We are all going to, if we're going to get wrinkles, we're going to get arthritis. But people hear arthritis, it's like, oh my God, I can't move. And I'm like, no, movement is good. Like, these are things that the body is going to age. It's just what it does, right?
I think it's hilarious when you're like, which one? And they're like, I don't know, just arthritis. And it's like, there's like hundreds of arthritises.
Yes, exactly. It's just someone just told me I have it.
Yeah.
And it's just like, a lot of it is just fear around something being wrong with the body. And it's like, I'm always telling you, it's not necessarily that something is wrong. It's just that maybe we can improve on something, but it's not necessarily that something is quote unquote wrong with the body. I think terminology is huge in terms of, like, how we educate patients. And then the other thing is that patients have Google now. So everybody is looking up their symptoms. Everybody is like,
they find out a lot of stuff.
The worst things. So that's another thing that we're battling with. It's the amount of Google diagnoses that come into the office. I'm just like, okay, stop Googling your symptoms and just come and speak to a professional.
The chiropractor guru, she just said the same thing, that she was thinking arthritis, and she was going to type in there that we can talk about that arthritis is something that a lot of people have.
Absolutely.
You know, I Googled, it's funny because it is very informative.
Mm-hmm.
but you really have to know what you're looking for because there's a lot of stuff to shuffle through.
Yeah.
And when you don't have the background information,
Mm-hmm.
some of the stuff that does pop up to the front is
Yes.
like the worst thing. Like, how common is headaches as a symptom?
Yeah.
How common is
Yeah.
like a cough or sneezing? Like, those are so common
Yeah.
in so many different conditions.
Yes.
It's like
Yes.
it's not giving us enough information to really go off
Mm-hmm.
of. But they like, oh, well, sometimes I can't pee, and like it's all kinds of
Yeah.
randomness. And you're like, they come back with this thing. I remember, I'll never forget this. I'm gonna tell you this story.
Let's hear it.
Um, there's this patient. He was like, I have thoracic outlet syndrome.
Yeah.
And I was like, okay. He's like, I did some research. I have thoracic outlet syndrome. So, of course, I'm thinking he's got something going on up here. Like, that's where his pain is, maybe some hands and arm pain or whatever. I was
Yeah.
like, so what's going on? This man starts to discuss to me, why was his pain in his lower ribs?
You're like, sir.
And then he actually, did he write it was when I was an associate. He like wrote a review about me or something that I wasn't, or he was going to write a review and wrote it to my boss or something and said I wasn't taking his concern like seriously. And I literally explained to him what thoracic outlet syndrome was,
Yes.
how you get it, and the different locations that it affects. And I was like, this is what you're describing and what you're saying. It's not thoracic outlet syndrome.
Yeah.
I was like, so we're going to figure out what you have going on, but that's not it.
Yeah. I feel like that's a battle that we fight sometimes. It's like, we're so pain. Of course, when patients are in pain, they're going to focus on their pain. I get it. Like, if something hurts, that's what you want to focus on. And sometimes I find the battle that I have with some patients is, okay, you may not trust me right off the bat, especially if you've never been to a chiropractor before. But it's like, okay, let me do my thing a couple of times and then tell me if you feel better. Because like you said, you could have, if you start treating his lower ribs and he starts to feel better. But if it's like he doesn't even give you that chance to treat it the way you want, because we know sometimes the pain is not always at the site, or the cause is not always at the site.
Right. That's yes.
Right.
It's most of the time
sometimes
it's not.
the battle is, let me do what I know may benefit for you. And then if we're not seeing that change that we want, okay, we'll switch directions. But sometimes, I don't know I feel like we're not always given the benefit of the doubt. And I know for myself, if I went into my family doctor and I said, these are my symptoms and they said, this is your treatment plan, this is what I want to do, it'd be instant. It'd be like, okay, doc, cool.
They wouldn't question it whatsoever.
Right? Not a question. There would be no question.
And
right?
that same person, he went to a stretch place. Like 2 days later or whatever. He got 2 adjustments, went to the stretch place. He was feeling a little bit better. I think he had like rib subluxation, posterior rib subluxation. I can't exactly remember. He was like, well, the stretch people said all I need is this. And I'm like, okay. Are they doing it? Like, okay, have them do it. If that's what you need. Like, well, okay. And then like he was a very combative patient. Yeah. And just like how you said, the MD, they'll give you the benefit of the doubt, and whatever the MD says, they'll just, okay, I'm going to do it. But the moment I went to speak on anything, he was trying to cut me off and why this wasn't it and why it wasn't that and X, Y, Z. And I was like, okay. At that point, it's, sir, I can't really help you if you are going to stop. But he continued to come in. Yeah. But then after he got seen like 10, 12 times or something like that. He complained and said, well, the doctor didn't care anything about me and she didn't help me at all. I want all my money back.
Oh, gosh. I think this is a great segue to patient mindset. Because I always tell my patients, if you don't believe something's going to work, chances are we can do everything right from top to bottom. But if you don't believe it's going to work, chances are it's not going to work. Right?
That's mental health.
Yeah, absolutely. We can be doing everything. We can be doing your adjustments. We can be doing your exercise. We can be working on sleep. We can be working on hydration. But if you don't believe it's going to work, or if you don't believe that you can get better, chances are you're not going to get better. Like that is such a huge key into treatment that I think that the patients don't take into consideration. It's like, either I'm going to have a miracle or I'm not. I'm like, chances are we're not going to have a miracle. We're either just going to work at this, and you're going to be in that mentality that, yes, I'm going to put in the work, and me and you, we're going to get better. We're going to work on getting you better. But if the mindset is not there, it's very difficult. And as a practitioner, and I'm sure you've experienced this as well, it can be very difficult to change a patient's mindset, especially I would say a chronic pain patient. So someone who I've been everywhere and I haven't been able to get better, or someone who I've tried everything and I haven't been able to get better. Mindset is very, very, very difficult. That's probably one of the hardest things in practice.
No, it is. It's really hard to get somebody's mindset, especially if they know someone who had a bad experience. Like that is even worse. And you're just like, okay, well, what happened? And then you try to tell them statistics and you try to educate them. Like education is the best thing that we could do to help patients feel better.
Absolutely.
And make them feel a little bit more comfortable that we know what we're doing, and we're not just going out there blind. We're not just like you know, our eyes are open. We've done all this learning and everything to give you the best holistic approach to care. So you can stay from under the knife. Like, that's my goal, is to help as many people stay from under the knife as possible for stuff that can be helped holistically. Like some stuff, if you got an ACL tear, you got in a huge car accident, like, you need to go under the knife. You know what I mean? But like other stuff, if you bent over and you can't get back up because you have a huge disc herniation, a lot of times they don't need surgery. They just need chiropractic care and therapy.
Yeah. First of all, we know that back surgery is only 50-50. So I'm just like, that's not good odds for me. That's not good enough.
I know, it's not enough.
Right? And the other thing that I say is, like, once you cut, you can't uncut. So if I give you a 6-week treatment plan and it doesn't get better, we didn't lose anything, but maybe a couple of dollars. Right? But I would rather try alternative care and try a 6-week treatment plan and not get better and know that I at least tried, and then go and do the back surgery and be like, okay, I've actually tried alternative care. Because I do have patients who have gone and done back surgery, right? And then we've come back, they've had the surgery, we've treated, we didn't get much places, they've done the surgery, and then they've come back and we've had full rehabilitation after that. Right? And now they still come and we're just doing their regular checkups and things like that. But once you cut, there's no turning back.
And a lot of times some of those patients have to have multiple back surgeries. And that's when it really gets really bad. And then they get the rods in there.
Yes.
Like, it's just so much stuff that goes with it. And it's just sad to see, because I used to work in a pain management facility as well. And you have patients who have had neck, low back, and mid-back surgery. Like, they've had multiple at one time, and it's like, oh my goodness. And then let's not get started on some of these scoliosis patients that you're just like, please, just let me get my hands on you a little bit earlier, so we can get this before it sets in permanently. So I guess it's getting a little late, so because we can go on and on. You're like I love this. This is great.
We'll do it again for sure.
Yeah. But I just want to have you just give some advice to students.
Okay.
And I think I have one more thing that I have asked every lady that has come on here. So just give some advice to students, and just, I don't know, some words of wisdom that you would want to give them, to future docs, people who are considering it, people who are in school. What would you like them to know?
This is good. I was actually talking to a Canadian student, but she's going to school in the States, and she asked if she could just pick my brain. And a couple of the things that I had told her was, get to know people, like, network as much as you can. The two situations that I'm in right now both came because I knew people. Like, I started volunteering with people, or like the inpatient facility. I was already in that position, but I reached out to people. So one thing that you should know is start to talk to people. It doesn't matter how early in your career, it doesn't matter if you're in first year, it doesn't matter if fourth year, start building those connections. It's so, so, so important. One, just for experience, right? You can learn from the mistakes of others. And then going on that is get a mentor. I think that is so important. Someone who can show you what they did that didn't work, what they did that did work. I think a mentor is so important, and especially in our profession. I feel like when you get out of school, there's not a lot of guidance. It's like, oh, you're out of school, you're a chiropractor, do your thing. And it's like, there's not a lot of guidance. There's a lot of figuring it out on your own. So a mentor can really, really help you skip some of these steps if you can have someone who will just direct you a little bit more. That's what I think is super important. And then the next thing is start figuring out how you want to practice. Because how you practice in school, I guarantee you, is probably not how you're going to practice exactly when you get into practice at all.
Well, yeah, because when you're in school, you have a standardized way of treatment that they want you to do, so you learn everything and you know, like, all this proper stuff, and then you realize when you get out, like, oh, I don't have to do exactly how they said it. I could do it a little bit differently. But I feel like you hit the nail on the head. You do need to network and all that. I think I might have mentioned on one of the other interviews I did, I wish I would have done something like that when I was a student. Like, I wish I would have got out, because now I'm having to learn. I had to learn these skills. I had to learn how to meet people. I had to learn how to talk to people already as a doctor, versus if you do this as a student, you kind of ahead of the game. You kind of done a lot of this stuff already, the groundwork for these relationships that you're building. And also it'll help you when you're trying to make some of these relationships later on with whether you're trying to start a new position at a new facility or whatever. Like, it really helps that you already have that know-how before you get out of school, before you have to pay.
Yeah, exactly. And it builds your confidence, right? It really builds your confidence. It's one thing to be confident when you're in school, but I was really nervous when I got out of school and had to start, like, treating patients on my own, and there wasn't anybody to fall back on. So it just builds your confidence a little bit more. So if you can start practicing it early, if you can start practicing that early, I think it's a game changer for sure.
Right. No, that's 100%. So the last question is, I guess two things. Two things. I'm sorry. First, I just want to take like 2 seconds just so we can both smile, so I can have a cover photo.
Oh, yes,
that's
absolutely.
a good. Both of us smile at the same time. Ready? Go. Okay, that's good. I know it's silly, but it's hard to find a good photo when you're each talking.
Branding on social media, I get it.
So the last one was, how does it feel to be in a field that is predominantly male? And predominantly the majority. So you are a female, and you're a minority. How does that feel? Like,
you know what? It's so funny, because it wasn't until I got into the chiropractic field, and I'll say as a student, that is when it really, like, of course, I know that I'm a woman and I know that I'm Black. Like, I can look in the mirror and see that. But it wasn't really amplified till I got to chiropractic school. I grew up in an area that was predominantly really diverse. Like, when I went to school, I wasn't the minority in high school. I wasn't the minority in elementary school. I wasn't the minority when I went to university, because it was just so diverse.
It's so mixed. Everybody was everybody.
Exactly. So it really wasn't really amplified for me in terms of, like, you are a minority, until I got to chiropractic school. Because in my year, I was the only Black student. So I remember the first day that we walked into introduction, like the introduction, congratulations, you got in, whatever. And I opened the door and I was like, oh, wow, okay. That was the first time in my life that I had, like, that it was really blatant that you're a minority, right? And just because I've never been in those environments growing up. I just wasn't in those environments. So you start to realize that you start to speak for more than just yourself. You start to realize that you represent more than, I'm not just Cassandra, I'm not just Dr. Cass, I'm also Dr. Cass, who's a female, who's a Black chiropractor. So then you start to realize that people are like, oh, there's Black chiropractors because I can see you. So I know that there is Black chiropractors. So instead of seeing it as something that's like a negative, I take it as a positive. Because I'm like, yes,
Mm-hmm.
we exist. We are here, right? You can be a female and you can be a chiropractor. And you can be a Black chiropractor. And a couple of things stack up against us. So one, of course, we're Black. So there's a bunch of things just historically that stack up against us. But secondly, there is so much stereotypes or false
stereotypes.
when it comes to being a female chiropractor. I've had guys who say, can you adjust me? Are you sure you're going to be able to get it? And I'm just like, yeah, like, I think I'm going to be like,
I had an old colleague. She actually now is an adjunct professor at Logan University.
mm-hmm.
She used to tell patients, she was like, do you know I am bigger than a vertebra?
Right.
I was like,
I love that.
Girl, you are so right. Like, you are
that.
for real. You are bigger than a vertebra.
Yeah.
Like, that is true.
I love that. I love that. I always tell people, I'm like, I'm not trying to muscle my way into your adjustment. I'm like, I don't want to hurt myself. I'm like, I have techniques that I will make your body do what I need to do to get an adjustment. Like, we'll figure this out.
I feel like as women, we finesse.
Yes. Yep.
We have to we finesse it. Like, we figure out tricks of the trade and how to do it so we can use as little effort as possible to get the same movement that that some use at using their strength, their body weight.
Yeah, for sure.
Of course, I'm not going to give the same adjustment that a 250-pound man is making. I'm half his size. You know what I mean?
Exactly.
So I know how to get the joint to move, but I have to finesse it in a certain way. It's not always going to go the way his does.
Exactly. And I think if we just take that back really quickly to giving some advice to the students, that's another reason that you really, really got to get your hands on a lot of bodies. A lot of bodies, like as much bodies as you can get your hand on, because you start to learn your tricks. Like, some tricks I'm still learning. Like, there's still new ways that I'm tweaking adjustments. Even up to this year, I started doing my cervicals a little bit differently this year. And I'm like, man, that goes like a lot smoother than how I was doing it before with my upper cervical. So you're still learning and tweaking it along the way.
Yes, that's really good. So good. I'm so glad that you took the time to be interviewed and on here.
Thank you for having me.
You probably gave a lot of inspiration. Like, to hear that you're working in an addiction and mental health facility, like, that is awesome to hear. I didn't even know that was something that could be done, and I'm sure I'm not the only one that knew that could be something that could be done. Because, I mean, you guys, if you want to do something like that, reach out to Dr. Cass, and maybe she can give you some pointers to get out there.
Yeah, please do.
And you know that they need it just as much as anybody else, because like she said, addiction started because of pain, most likely.
I still think there's a lot of industries that chiropractic can make its way into. We just got to keep doing the work.
Pushing. Yeah, keep pushing. So next week, everybody, Dr. Banks is actually going to be doing the interviews, and she's going to have a phenomenal doctor to interview again. So we'll be back next week. Thank you, Dr. Cass, for
and thank you, Dr. Raquel, for setting up this platform and for doing these.
No problem.
Like, you're doing good work. You're doing awesome work.
Thank you.
You're so welcome.
I do want to show you guys one thing. I do have on, I know I have this big, huge sweater on, but like I said, it's cold out here. So if you guys are interested, I know it's talked about the shirts, because we are trying to raise money so that we can do other stuff with this platform, and not just all the stuff that's low key and inexpensive. So can you see my shirt?
Not yet.
So if you guys want the shirt that is with the woman on the back, with the woman doctor, you can get it with.
See it.
Uh-oh. I thought you could. Can you see it now?
Yeah.
Okay. So you can get your logo on it. So this is my logo for my office, and then let me try and do some squatting.
Oh, nice.
And then that's on the back. So like, if that's something that
for sure.
Yeah, if that's something you guys want, just let me know.
Absolutely.
Let us know. And we're trying to figure out a different, we're just going to be selling it, and we're doing PayPal-less payments.
Okay.
And we're just trying to take CWC to a whole nother level so that we can reach as many people as we can.
Absolutely.
We're international, baby.
Yes.
Because we got Canada. We also have someone in our group that is from Australia.
Oh,
So
nice.
hey, we're trying to make this thing large and in charge.
Love it.
And everybody's welcome, because depending on what part of the world you are a minority.
Exactly. This is true. This is true. This is true.
But all right. Well, until next time, guys.
Thanks,
See
guys.
ya.
Bye.
Bye.